All right, deep dive time. And this one goes out to you. Remember you sent in that October 2024 issue of Pediatrics in Review. Buckle up, because we're covering a ton, from the latest on vector-borne diseases to some head-scratching infant cases. Oh, and there's even one about, wait for it, extreme hypertriglyceridemia.
Yeah, you definitely don't want to miss that one. It's a really great mix of articles in this issue. It kind of reflects all the different stuff pediatricians deal with every day. So we're going to dig into the newest research on those everyday things, plus some rare but really important conditions. And hopefully you'll walk away knowing more about advocating for your own little ones.
Awesome. So let's jump right in. First up, this article on vector-borne diseases. Kind of a bummer reminder that climate change is messing with our health in some pretty scary ways.
Uh,
The article zeroes in on 5 big ones: West Nile, Lyme, dengue, malaria, and Rocky Mountain spotted fever.
It's definitely timely. I mean, the Intergovernmental Panel on Climate Change, they've been warning us that these diseases are on the rise everywhere, and if we don't step up our game with controlling them, we're going to see a lot more cases in the future.
So besides the fact that it's, well, bad news all around, what surprised you about these diseases?
Well, like with West Nile, did you know most people who get infected don't even have symptoms?
Really?
Yeah, they could be spreading it without even realizing it. But then you have older adults who are way more at risk for getting seriously ill, even dying from the same virus.
Wow, that is sneaky. And Lyme disease, that one just seems so hard to diagnose. Plus, the article said cases are spiking in the U.S. too, which is a little worrisome.
Yeah, for sure. And catching it early is key. It goes through stages from like a localized infection to potentially impacting your nervous system, joints, even your heart. Catching it in that early stage where some people get that bullseye rash, erythema, migraines, it makes a huge difference for treatment. Oh, right, right. Speaking of diagnosing, dengue fever. They had this thing about a tourniquet test that I'd never heard of before. Apparently, it's the top reason for fever in travelers coming back from certain areas like the Caribbean and South Asia. It's a pretty simple test, but insightful. They put a blood pressure cuff on your arm, and if you get a bunch of little red spots, it could be dengue. It's not perfect, but it can be a big clue, especially in places where dengue is common.
Interesting. Now, malaria, I always think of that one as like a far-off threat. But this article, it was a good reminder that it's still really serious, and the treatment, it's not one size fits all, is it? You really got to know what specific parasite is causing it to pick the right meds.
Exactly. And out of all of them, Plasmodium falciparum, that's the one you really don't want to get. That one causes the most severe cases and a lot of deaths, especially in parts of Africa.
Right. And then last but not least, Rocky Mountain spotted fever. You'd think it's only a problem in the Rockies, but nope, it's actually found in a lot of areas.
And what's really important with this one is that treatment can't wait for lab results. It can be deadly. So starting antibiotics right away, just based on what the doctor sees, can be life-saving.
Okay, so zooming out a bit, what does this surge in vector-borne illnesses mean for us? I mean, beyond just trying not to get bitten by every bug out there.
Well, it raises some big questions about public health, like how will these trends change travel recommendations? How can we better protect people who are more vulnerable? As the planet gets warmer, these disease-carrying insects are spreading to new areas, so it's not just a traveler's problem anymore.
So what can we do as individuals to lower our risk?
Well, being aware is huge. Like, if you're traveling to a place where these diseases are common, take precautions, use insect repellent, wear long clothes, and if you get any symptoms after a trip, go see your doctor and make sure to tell them where you traveled.
Makes sense. All right, let's switch gears to something all parents can relate to. Brief resolved unexplained events, or BRUEs. Man, even the name sounds scary. I can only imagine how frightening those episodes must be.
Yeah, they can be pretty scary, for sure. BRUEs, they involve these sudden, brief changes in the baby's breathing, color, their muscle tone, or how they respond. But the important thing is that they resolve quickly, and no one knows for sure why they happen.
And here's where it gets interesting. The article mentions that the American Academy of Pediatrics, the AAP, their risk stratification model, it might actually be leading to too many babies being hospitalized for these events.
Yeah, it's a good point. The model, it labels 95% of BRUEs as high risk, even though most of the time they're totally harmless. So while we definitely need to rule out anything serious, we also have to think about, the downsides of doing unnecessary tests and the stress that puts on families.
So what's the main takeaway for parents who go through a BRUE with their baby?
It's all about watching them closely. Most BRUs are fine, but there are some red flags to look out for. Table 2 in the article, it does a great job of outlining those warning signs, across different categories like neurological, gastrointestinal, and cardiac.
Gotcha. So we won't go through the whole table now, but it sounds like something parents should keep handy, just in case.
Definitely. Because while most of these events are harmless, there's a small percentage that DO have a serious underlying cause, and those need to be found quickly. So things like if the baby has repeated episodes, unusual eye movements, or a family history of seizures, those would need more investigation.
Okay, makes sense. Now, let's dive into some cardiology cases. These really showed how important it is to keep an open mind and consider all the possibilities, especially when it comes to newborns and infants. The first case was about a newborn who seemed perfectly healthy, and then suddenly, at 8 days old, everything changed.
Oh, yeah, that one was tricky because at first everyone thought it was sepsis, which is pretty common in newborns, but it turned out to be a rare heart defect called interrupted aortic arch, and the standard pulse oximetry screening, it didn't catch it at first.
Wow, so that screening all babies get, it's not foolproof. That's something I bet a lot of parents don't realize.
You're right, no test is perfect. And this specific defect is what we call ductal dependent, which means the baby's survival depends on the ductus arteriosus, this little blood vessel connecting the aorta and pulmonary artery, staying open. When it starts to close naturally after birth, like it should, circulation to the lower body gets cut off, and that leads to shock.
So the heart defect was kind of mimicking the signs of sepsis. That's been a tough one to figure out.
It was. And speaking of tricky presentations, remember that second case with the premature baby who was having trouble breathing?
Yeah.
At first, it seemed like the usual preemie stuff, but it turned out to be a heart defect called an atrioventricular septal defect, basically a hole in the heart that affects both the upper and lower chambers.
So sometimes even experienced doctors can be fooled by the initial symptoms.
Absolutely. That's why we have to consider everything, especially with preterm babies who are already at higher risk for breathing problems.
Right. And the third cardiology case, that was about a toddler, right?
Yeah. Yeah, a 15-month-old girl who went into shock after a super routine procedure, just draining an abscess.
Oh, wow, that's so scary. What could cause such a severe reaction from something like that?
In this case, it was a hidden congenital coronary artery anomaly called left coronary osteolatresia. Basically, the left coronary artery, the one that supplies blood to the heart, was blocked.
So what's the big takeaway from all these cases?
I think they show how important it is to have specialists in pediatric cardiology, and they show that even things that seem straightforward can have surprising causes. It's a reminder for everyone, parents and doctors, to stay curious and consider every possibility.
Good advice. It seems like in medicine you can never assume anything. Now, let's move on to the index of suspicion section, where we'll unravel the case of the strange umbilical discharge.
Okay, so this one is about a 3-week-old baby boy who has a fever, a fast heart rate, and a history of umbilical discharge. At first, they thought it was sepsis, which is always a worry with newborns, but they couldn't figure out where the infection was coming from.
So where did they finally find the culprit?
An abdominal ultrasound showed an infection around the umbilical vein.
Huh? That's not something you hear every day. What makes the umbilical area so prone to these tricky infections?
Well, when the baby's in the womb, the umbilicus is like their lifeline, connecting them to the placenta. But after they're born, when the umbilical cord dries up and falls off, what's left behind can become a way for bacteria to get in.
So this case really shows how important it is to pay attention to even the little details in a patient's history, right?
Exactly. The fact that the baby had umbilical discharge, even though it had gone away, that was a key clue that led to the right diagnosis.
Like a medical detective putting all the pieces together. And speaking of mysteries, let's talk about this case that really blew my mind. The 12-year-old girl with lupus who had a triglyceride level of, get this, 26,541 milli-GDL. I had to read that number like 3 times to believe it.
Yeah, you don't see that every day. It really shows how autoimmune diseases can have unpredictable and severe complications.
So how can someone even have a triglyceride level that high?
Well, hypertriglyceridemia can happen with lupus even when people are being treated. This girl had recently been given high-dose corticosteroids, which we know can raise triglyceride levels, but hers were crazy high, even for someone on steroids.
So there had to be something else going on too.
Right. The article goes into the whole science of lipid metabolism, explaining how important these two proteins are. lipoprotein lipase, or LPL, and glycosylphosphatidylinositol anchored high-density lipoprotein binding protein 1, or GPI-HBP1.
Okay, hold on. Don't get too technical on us. What do those proteins actually do?
Sure, basically, these proteins work together to break down triglycerides in the blood. They're like garbage collectors for fat molecules. In this case, something was preventing them from doing their job, and that caused the massive buildup of triglycerides.
Ah, okay, so the garbage collectors were on strike. What's the main message here for those of us who aren't experts in lipid metabolism?
It shows how important it is to be really careful and have individualized treatment plans for people with autoimmune diseases like lupus. Even when they're being treated, these conditions can throw curveballs, and sometimes you get these really unexpected complications.
It's a good reminder that these diseases can affect lots of different organ systems, so we got to be on the lookout for any signs of trouble. All right, before we wrap up part one of this deep dive, let's do a quick rundown of some of the other cool articles from the In Brief section.
Sounds good. What caught your eye?
Well, this one, acute onset elbow pain in a 14-year-old football quarterback. It's a good reminder that Little League elbow, that overuse injury, it's not just for baseball players anymore.
Yeah, you see it more and more in other sports too, especially ones with a lot of repetitive arm motions like football and tennis.
Right, and the takeaway was that rest is super important for it to heal. Playing through the pain just makes it worse. Then we have a mouthful, recurrent oropharyngeal bleeding in a child. Now that one sounds kind of scary.
It does. This case was about a kid who had a hidden pseudoaneurysm after hurting their tongue, something that seems really minor.
A pseudo what now?
A pseudoaneurysm, it's like when a weakened artery balloons out, sort of like a mubble. In this case, you couldn't see it, which made it harder to diagnose. The child had a bunch of episodes of serious bleeding from their mouth, which is why it was so important to think about the wear possibilities even after a minor injury.
So the lesson there is, if your kid has unusual bleeding, even if it seems small at first, get it checked out by a doctor. Better safe than sorry, right? Okay, next up, syncope, fainting spells. It seems like everyone faints at some point, right?
Yeah, it is pretty common, but it can be scary, especially in kids. This article helps figure out what's a normal faint and what could be a sign of something more serious, which is good for parents and doctors to know.
And didn't the American College of Cardiology recommend an ECG for every kid who faints for the first time? That's important for parents to know.
Yeah, it is. It's a really easy test that can rule out any underlying heart problems, which can sometimes cause fainting, especially in kids.
Good point. All right, last but not least, we've got Mpox, monkeypox, infection in children. It feels like there's a new infectious disease every month these days.
It does, doesn't it? But the good news is the current strain of Mpox seems to be milder in kids than adults.
Oh, that's good. But it's still important for parents to know the symptoms, fever, rash, swollen lymph nodes, and to get medical help if they think their child might have it right.
Absolutely. Staying informed about new infectious diseases is crucial.
All right, that wraps up part one of our deep dive into the October 2024 issue of Pediatrics in Review. We covered a lot, but there's more to come.
You know, it's really amazing how much pediatrics has changed. Even something as simple as a rash, it can be a sign of something way more complicated going on underneath.
That's a perfect lead-in to the visual diagnosis section. This month's case is a real puzzler, a newborn with a purpuric rash. Now, for those of you who, like me, might not be familiar with that term, purpuric just means purplish spots or patches caused by bleeding under the skin.
And this case is extra interesting because the baby had a totally normal birth, no signs of anything wrong, and then all of a sudden, bam, this rash shows up and everyone's scratching their heads.
It's like a medical mystery novel. So what goes through your mind when you see a newborn with a rash like that? What are the first things you think about?
Well, the baby's age is a big factor. With newborns, these purpuric rashes can be caused by so many different things, from something harmless like birth trauma to more serious stuff like infections or problems with blood clotting.
So in this case, what were the initial thoughts?
They thought about a few things like immune thrombocytopenia. That's where the body's own immune system attacks platelets, which causes easy bruising and bleeding. They also considered infections like congenital cytomegalovirus or herpes simplex virus, which can cause skin lesions.
But those were ruled out, so what did it end up being?
Neonatal lupus erythematosus, which is a rare autoimmune condition that can affect babies born to mothers with certain autoantibodies.
Okay, now you're going to have to break that down for me a bit. What causes neonatal lupus, and how does it end up causing that purpuric rash?
Sure. So it's caused by these maternal autoantibodies, specifically anti-RASA and anti-SSB antibodies, passing from the mother to the baby through the placenta. These antibodies can mess with the development of certain fetal tissues, including the skin and the heart.
So basically, the mom's antibodies are attacking the baby's own tissues.
Right. And in this case, the rash happened because of inflammation and damage to the blood vessels in the skin, which led to those purpuric spots.
And you mentioned the heart. Are there other risks for babies with neonatal lupus?
Yeah, the one that's most worrisome is congenital heart block, which means the baby's heart rate is too slow. That's why it's so important to keep a close eye on these babies and do an electrocardiogram to check their heart rhythm.
It's amazing how much we can learn from something like a rash. It's like a window into what's going on inside the body.
Definitely. It shows how important it is to get a good medical history, carefully observe the baby, and do the right tests. You can't just jump to conclusions based on how things look.
Okay, enough about rashes. Let's talk about those in brief articles we skipped over earlier. That first one, acute onset elbow pain in a 14-year-old football quarterback. What was the main takeaway there?
It's a reminder that Little League elbow, that common overuse injury, it's not just for baseball players. You see it more and more in other sports like football and tennis, where there's a lot of repetitive arm motion.
Right, and the big thing was that rest is crucial for healing. Don't push through the pain. It'll just make it worse in the long run. Then there was that case, a mouthful, recurrent oropharyngeal bleeding in a child, which honestly sounded a bit scary.
Yeah, it did. This case was about a child who had this hidden pseudoaneurysm after hurting their tongue. It seemed like such a minor injury.
Hold on, a pseudo what?
A pseudoaneurysm. It's when a weakened artery bulges out, kind of like a bubble. But in this case, it was hidden, so it was hard to diagnose. The child kept having episodes of serious bleeding from their mouth, so it was really important to think about the rare possibilities, even after a small injury.
So the lesson is, if your kid has any weird bleeding, even if it doesn't seem like a big deal at first, get it checked out. Next up was syncope or fainting spells. Seems like almost everyone faints at some point.
It is pretty common, but it can be frightening, especially when it happens to kids. This article helps figure out the difference between normal fainting and fainting. That could be a sign of a bigger problem.
And didn't the American College of Cardiology say that every kid who faints for the first time should get an ECG?
Yeah, they did. It's a really simple test that can rule out any underlying heart issues, which can sometimes be the cause of fainting, especially in kids.
All right, and finally, Mpox, monkeypox, infection in children. Feels like there's a new infectious disease to worry about every other week.
It does feel that way sometimes. But the good news is, this current strain of Mpox seems to be milder in children than in adults.
Oh, that's a relief. But parents should still know the symptoms, fever, rash, those swollen lymph nodes, and when to get medical help.
Exactly. Staying informed about new infectious diseases is super important.
Okay, so we just did a whirlwind tour of the in brief section. Those shorter articles are always so fascinating. They cover so many different things, and they always leave me wanting to learn more.
Me too. And it reminds you that the world of pediatrics is always changing. There's always something new to learn and discover.
Well, speaking of learning, I'm curious to hear your thoughts on the ethical side of things that this issue of Pediatrics in Review brought up. There were a couple articles that really got me thinking.
For sure. Ethics is a huge part of practicing pediatrics, and these articles really highlight some of the tough decisions doctors and families have to make all the time.
One of the articles that stuck with me was about using artificial intelligence in pediatric care. It's amazing to think about how AI could change diagnosis and treatment, but it brings up a lot of ethical questions too.
Yeah, it's pretty mind-blowing. AI can look at huge amounts of data and see patterns that humans might miss, which could mean earlier and more accurate diagnoses. But there are also concerns about bias, privacy, and, could AI replace the human connection in healthcare?
Right, and if an AI system makes a mistake, who's responsible? Those are questions we're just starting to figure out, but they're super important as AI becomes more common in healthcare.
Definitely. And it's so important that we talk openly and honestly about these things, involving patients, families, doctors, and ethicists, to make sure AI is used responsibly and ethically in pediatric care.
Another ethical dilemma they talked about was genetic testing in kids. Genetic testing can give us valuable info about a child's health risks, but there are concerns about privacy, discrimination, and the possibility of parents making choices based on incomplete or maybe even inaccurate information.
You're right. And there's also the question of, should a child be able to say no to genetic testing, even if their parents want it? These are complex issues, no easy answers. It just shows how important it is to talk openly and make decisions together, families and healthcare providers.
It reminds us that medical decisions aren't always black and white. There are so many things to consider, especially when kids are involved.
Absolutely. And that's why it's so important to have a good ethical framework to help guide those decisions and make sure we're always acting in the child's best interests.
Well, this has been a really thought-provoking conversation. It's amazing how much you can learn from just one issue of Pediatrics in Review. It's not just about the latest research. It's about the human side of medicine and the ethical challenges of caring for children.
Couldn't agree more. It's a reminder that medicine is more than just science. It's about compassion, empathy, and really caring about the well-being of our patients.
Okay, before we move on to part 3, where we'll wrap up this deep dive with some final thoughts, I'm curious, what are you most excited about for the future of pediatrics?
Oh, that's a good one. Honestly, I'm really optimistic about the future of pediatric care. There are so many breakthroughs on the horizon, like gene editing therapies and personalized medicine based on a child's unique genes.
It's mind-blowing to think about the possibilities. And with all the advancements in technology, we can provide healthcare to kids in ways that are more accessible and engaging than ever before.
Exactly. Just imagine, virtual reality could help kids deal with pain and anxiety during procedures, or telemedicine could allow kids in remote areas to get specialized care without traveling far.
Those are some amazing possibilities. And it's not just about technology either. There's a growing focus on preventive care and looking at children's health holistically, not just their physical health, but also their mental, emotional, and social well-being.
Exactly. It's about making sure all kids have the chance to thrive and reach their full potential. And I think that with all the innovation, collaboration, and dedication to child-centered care, we can make that happen.
That's a fantastic note to end part 2 on. Stay tuned for part 3, where we'll finish up our deep dive with some final thoughts from this incredible issue of Pediatrics in Review. And we're back for the final part of our deep dive. My brain is officially full after those first 2 parts. It's kind of crazy how much there is to learn from just one issue of this journal. And it makes you realize this is just the tip of the iceberg when it comes to pediatrics.
It really is amazing how much there is to know, right? Each article is like a little peek into a different part of child health. It really shows you how complex and diverse the challenges are for pediatricians every single day.
Speaking of challenges, one thing that really stuck with me from this issue was how much medicine is always changing. Like there's always new research coming out changing how we diagnose and treat and prevent diseases. It makes you realize that even the experts are always learning.
That's so true. It's not just about keeping up with the latest research either. You have to be able to adapt, be open to new ideas, and question what you think you know. Because what we know today might be different tomorrow, and that's what makes this field so exciting.
So as we wrap up, I'm curious, what do you think the future holds for pediatrics? What kind of advancements or challenges are you looking out for?
Well, one thing I'm really excited about is personalized medicine. You know, with all the progress in genetic testing and data analysis, we're getting closer to being able to customize treatments for each kid based on their own unique genes. Like, imagine being able to predict a child's risk for certain diseases and stepping in early to prevent them, or developing targeted therapies that work better and have fewer side effects.
That sounds like science fiction, but it's becoming more real every day.
It is, and it goes beyond just genetics, too. We're seeing amazing things happening in gene editing and stem cell therapy, stuff that could completely change how we treat childhood diseases like cancer, genetic disorders, you name it.
And what about technology? How do you see that shaping pediatric care?
Oh, technology is already a big part of it, and I think it's just going to keep growing. Telemedicine is becoming more common, which is great for kids in remote areas because they can get specialized care without having to travel far. And people are getting more and more interested in using virtual reality and augmented reality, creating these immersive experiences that can help kids deal with pain and anxiety during procedures.
That's amazing, using technology to make healthcare more accessible and engaging, maybe even fun for kids.
Exactly. And it's not just about cool gadgets either. There are also powerful new data analytics tools that can help us see trends in child health, which could lead to better prevention strategies and public health programs.
It sounds like the future of pediatrics is pretty bright, but I imagine there will be some challenges too, right?
Right. As we develop these new technologies and treatments, we have to be really careful about the ethical implications. We got to make sure they're used responsibly and fairly. And we need to tackle the problem of health disparities, making sure that all kids, no matter their background or their family's income, have access to good quality care.
That's so important. It sounds like the future of pediatrics is about finding a balance between innovation, compassion, and a real commitment to making sure healthcare is fair for everyone.
Absolutely. We need to have open and honest conversations about these things, and everyone needs to be involved patients, families, doctors, ethicists, policymakers to make sure we're creating a future where all children have the chance to thrive.
Well, it's been an awesome journey digging into this issue of Pediatrics in Review with you. I feel like I've learned so much, not just about specific diseases and treatments, but about the bigger picture of keeping kids healthy and the challenges and opportunities that are out there.
I've enjoyed it too. I hope everyone listening learned something new and maybe feels a little inspired to learn even more about the world of pediatrics.
And if you want to dive deeper into any of the things we talked about, I definitely recommend checking out the full articles in the October 2024 issue of Pediatrics in Review. You can find it online or at your local library.
And if you have any questions or topics you want us to cover in future deep dives, don't hesitate to reach out.
We love hearing from you. This deep dive is for you, after all. Until next time, stay curious and keep those deep dives coming.